So what's next, guys? What's next on the Dental Supreme schedule? What do you guys have planned? What do you guys want to reach so far?
Luis looks a little tanned, right?
He does look a little tan.
Oh, yeah.
Have you been tanning, buddy?
I was in Punta Cana.
Oh, that's the way to start the podcast. What would you go do there? It's so hard for you guys to go to a training and not be critics. Because when you go to a training, you want to learn. You want to be wowed. You want to be like, oh my gosh, how am I going to bring this back?
Challenge, any broken bone, any patient with a lot of complications, bone destructions, I think is the next level for us.
Like, I know you put your trust on us, you put your trust on these guys, you put your trust on Supreme. We're going to take care of you. Yes, sir. But the big difference is we were sitting out, all three of us were sitting down and we're talking about what's next. What's next?
In odontology.
What's next? Yeah, what's
in
next,
dental.
guys? What's
Second
next?
anniversary.
Thank you so much. This is a 2-year anniversary that we have for this podcast, and obviously this has been
2 years.
a blessing. Everything started on
It was all a dream. I used to read Word Up magazine. Salt and pepper and heavy D up in the limousine.
Welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us, and we appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you, our patients. My wife and I are the owners of Supreme Dental Clinic. Listen, we're in Apple Podcasts and Spotify, and starting today, we also have snow products here at the clinic for you guys, so you guys can keep your teeth nice and white, water floss, whatever you want, we got it. And today we have Dr. Luis. How you doing, Dr. Luis?
Hello, Frank. I'm good. I am
We
ready.
have Dr. Elias.
Hello, Frank. How are you? Luis looks a little tanned, right?
He does look a little tan.
Oh, yeah.
Have you been tanning, buddy?
I was in Punta Cana. last week.
Oh, that's the
Yeah.
way to start the podcast. What would you go do there?
Too much sun.
Cooking classes or what?
It's for classes and vacations together.
What kind of classes did you take?
It's information about the new systems in Straumann implant.
Straumann, okay.
The new technology with the new programs, Smile Club. We have the opportunity to learn with the top doctors. They are using the best technology right now. They are using like spatial scans to take the face, to do a better teeth with more precision. It's a wonderful experience.
Question.
Yeah.
Do you think, because we talked about this off air when he was back, do you think what you saw from them and the technology that we're using here, as far as scanning, because you mentioned that they were still taking impressions, right?
Right. Yeah.
So what did you notice between their technology and the technology we have here?
Well, it's a good technology, but probably it's not the best. We have the best here, big, the machines, but that technology can help us.
So they're not scanning?
It's a software. It's a Smile Club, the software. Is to do the design of the smiles.
But like for implants, they're still taking impressions, or
Yeah. It's a confusion because everything is digital, but the mold is analogic.
So
the regular mold.
How can they say everything is digital, but the mold
is
not digital?
It's not digital. Yeah.
the first part, the basic.
Well,
It's a confusion in my mind because if everything is digital, why the most important part is the mold?
yeah, exactly, because that's what you guys base everything off of, is the mold.
Yeah.
But that wasn't digital?
Nope.
How does that make sense?
It's analogic. It's a regular mold, old school. But
Why didn't you tell him? You're like, I object. You should have said so. Why didn't you say anything?
honestly,
I smell BS.
I prefer to stay quiet.
Oh, wow.
Well, yeah.
At the beach. I prefer to stay
A lot of people
At the
in the
beach?
room. Yeah.
I prefer to go to the beach
Yeah.
and ride razors. We'll put a couple pictures up here of Dr. Luis when he was over there in Punta Cana, and you went there with Ernesto, Carranza, one of our agents, Jessica, and also my father, Francisco.
Yeah.
Shuttle, because you need to learn how to drive the shuttle when you're in Punta Cana also. You're going to keep everybody fresh, So that's awesome. I mean, you know what? Talking a little bit about that. So you went to Punta Cana. You said there was a lot of dentists there.
Yeah.
You've seen technology like the Smile Cloud that's not from Straumann.
Yeah.
The Smile Cloud is something.
Yeah.
that was there, but it's not from Straumann.
It's another, it's different.
And you were able to see different things from Straumann that we do not get here in Mexico, correct?
Like the new implant, IXL, but not in Mexico.
Yeah, because everything in Mexico is a little bit harder to come in.
Maybe next year.
Because of COFEPRIS, right? Which is like, what is a COFEPRIS?
FDA.
Like the FDA?
Mm-hmm.
Yeah, which doesn't make any sense because the rest of the world has it, including the United States. But, hey, we got to keep on trucking. But it gets kind of hard because every time you guys go to a training, it's so hard for you guys to go to a training and not be critics. Because when you go to a training, you want to learn. You want to be wowed. You want to be like, oh my gosh, how am I going to bring this back? But we're at a level that just last week we were talking to Pini Naftelli from the CEO, owner, creator from Implanted. And you were talking to him. And I always felt like you were just like, But now you talk to him. And he explained to you a whole bunch of stuff that perhaps you didn't know about because that's what he does. So you're like, hey, this guy's pretty smart, right? Then you guys also had a training today with Albert Ramirez, which he's in Spain, about how to do the immediate loads
With
more
the
digital process faster and everything.
Faster, yeah.
Which you say that it wasn't really what you were looking for, but you were able to get kind of like the process of it. And David from the lab, take a look at it from our lab and kind of flip the switch to go to what you were also looking at doing. So it helped, but it wasn't like, oh, because of this course, I'm doing what I'm doing right now. So it gets really hard to actually wow you guys when you guys go on these trainings. Except Mykonos. Mykonos, Greece, you guys came back like, oh my God, it was so awesome. Like, oh my God, we learned so much. Everybody was there, and this guy came and talked to us. Like, I never seen you guys that happy. And then he jumped out of a boat and he swam all the way to shore. But it's everywhere you guys go, you guys go like, hey, it was a training. It was a good vacation. Except when you went with Juan Gonzalez. But that's not a training. That's is it a residency kind of?
Yeah, sort of like a residency, yeah.
You went with Juan Gonzalez, one of the top dentists in the world, to Brazil.
Brazil, yep.
And you and Alonso went also to Brazil.
With Dr. Vanderlim.
With Dr. Vanderlim. So that became like, that was a full learning on experience.
Yeah, that wasn't a congress or it wasn't like, it was actual hands-on surgery on live.
Surgery lives, yeah. On the hospital.
And that's a huge difference because at Congress, you put your blazers on, get your cappuccino, mochaccino, whatever chino you want. Or if it's Straumann, it's water. And oof, is it hot in here? and
Shout out George.
And you sit right there and you just listen to somebody talk. And a lot of the times, and not to throw any names or not to be messed up to anybody, but when somebody's up there talking about how they put a crown over an implant, or you guys, to me, you guys are monsters. So you guys are doing zygomatic. Actually, I'll put a video here when you were looking at a case for quad zygomas. That's huge. So that doesn't really impress you guys. So it's so hard to send you guys to a place. By send, you mean giving you guys the opportunity to go because you guys pay for your guys' trainings. And
I think the best, the next level for us is
the moon.
The time, to reduce the time.
That you wanted to go with Katy Perry to the moon.
Yeah. For example, the Straumann Congress is the opportunity to learn about the new system on the company.
Okay.
But not the best technology or the best treatments.
It's the best technology and treatments that they got.
For them.
Yeah.
Okay.
Yeah.
And the residency is you guys get to not wear suits. It's like you guys are going to.
It's like the real life.
Okay.
Yeah. To learn about, I don't know, any challenge, any broken bone, any patient with a lot of complications, bone destructions. I think is the next level for us. Okay. To rescue that patient.
What you guys say about that?
Well, yeah, I think the main difference between when we go to something that's from Straumann, as you mentioned, is that it's more relaxed. It's more to see different ideas. And when we actually go to a residency, it's more of, all right, we're going to be here from 8 a.m. to 7 p.m. and we're going to be working hard. You know, it's a whole different thing because it's not powered by a brand of implants. So there's like, okay, if when we go to a residency, it's like you're going to use whatever works best.
Yeah.
You know, it's the different protocols and we bring that in. And touching back to what you said about that it's very hard to impress us with courses like the course that we took today with the guys from Spain, is that every dentist, I think around the world, has a different protocol, even if it's the same thing, but we have to adapt what works best for us with the technology that you have in your hand, with the time frame that the patient has. And we have to tweak things and we have to get a little bit of everything and we have to make our own protocol. So what we do is not exactly the same of what someone next door to us does, because we also have to adapt to our skill set. So it's sort of like cooking, how everybody could do a pizza, but everybody has a different recipe. It works the same way. And that's why when we talked today to the guys from Spain, we want to do what Jeffrey is doing.
Jeffrey
Tabone, yeah, from the Segmark Workflow, Chairside Solutions, Implant Center in Texas.
Yeah.
And we got David, and he saw how they managed the CT scans, and we were able to match our CT scans. And actually, we're working on that right now. How we're gonna get Jeffrey's workflow, their workflow, and just develop our own workflow that's gonna work for us.
And shout out to Jeffrey. Shout out to Jeffrey Tobon. We were actually on a Zoom with him.
Yes.
A couple months ago.
Couple weeks.
Couple weeks. Time.
It goes fast. Yeah.
Okay. And he was talking. He was a cool guy. He was talking about all the stuff and all the things he's doing. Hopefully, we have him here someday in the near future. We were just talking about, what was it? Yesterday? Yeah, yesterday we were talking about there's different dentists at different times. And I'm going to be completely honest with you guys. There's dentists that are in their late 30s, early 40s, mid 40s. And I've heard this before, but not just in dental. I've heard it in business that they say, hey, you're young, man. You're young. Yeah. Go ahead and you guys tear it up. You guys do what you got to do. You're hungry. I've been following you guys. You guys do great work. I used to be really good at what I did, but hey, man, you guys are young now. I'm going to relax. I've heard that in business all the time. I'm going to relax. To me, that's kind of telling me the new times changed. I stuck to my old ways, and I don't want to go to what the future brings, which is okay. It's okay for me because I want to change. I want to adapt. I want to keep on moving forward because that's what makes everything just flow better. Yesterday, we were all in the meeting, all three of us. We were talking about there's different dentists out there. People love to golf. People love to scuba dive. People like to go fishing. People like to DJ.
Yeah.
Good for them. Good for them.
Yeah.
But the big difference is we were sitting out. All three of us were sitting down, and we're talking about what's next. What's next?
In odontology.
What's next? Yeah, what's next, guys? What's next? We have all these kinds of stuff. There's people that have came up to me before and said, hey, man, come on, man. Every time we're trying to catch up, you guys have something else, and then something else, and then something else. We're expanding the lab. We're bringing in the best machine there is right now for milling, and it's super fast for titanium. We're incorporating titanium bars, but we're perfecting them. You guys training in Spain. Right now, shout out to Dr. Alonso also. He's in Vienna, Austria. He's doing a course over there too. You just came back from Punta Cana. You want to go to Guatemala?
Guatemala.
You know what I'm saying? Everybody's always going somewhere. And we were stuck in the room and we're like, yeah, man, everybody's doing this and that. We're here talking about what's next. What's next? It's never enough because there's always new cases that push us to another limit. I mean, gosh, man, I wish I would have done this differently because now I know what I didn't know 8 months ago, a year ago. And I believe that it's when your job and your hobby and your passion align.
It's the same thing.
It becomes the same thing, and it just becomes growth. Yeah. It's so easy for me just to say, hey, man, I'm 38 years old. I'm not a dentist. We're good. We got a podcast. George records videos. You guys are monsters. Let's do it. But why do we keep on pushing each other? Because when I see a patient come out and says, oh my God, they turned me away from so many other places and you guys decided to help me, that's why. When I see your guys' face, and guys, you guys don't know this, but sometimes I get to the office and these guys, hey Frank, you gotta come take a look at this X-ray.
Mm-hmm.
Take a look at this video.
It's exciting.
And I'm looking and there's no teeth anymore. And oh, here's the implant, here's this. And I'm looking at it, but I'm looking at you guys because it's like you guys are so excited. I call it dental porn, but it's so excited. You guys are so excited what you guys are doing because that's your guys' passion. So if someone told me, Frank, for $5 million, do you think that Luis or Elias, when they're 40, 41, 42, 43, 44, will they stop caring about odontology? Will they stop caring about being a dentist to do another passion? I could bet you $5 million and I would say no. Because you guys may have clinics. You guys make people have working for you guys. You guys may have a whole bunch of houses and Airbnbs, but you guys are always going to stay around with what is the latest and greatest. And why is it that? And then argue about it like, well, you know what? I feel some problems are going to happen because of this, this, and this. And that's what keeps you mentally sharp. It's things like that. So it comes to my connecting everything together is when a patient calls one of our agents and then compares us to another clinic here in Los Algodones, it's normally not to the top clinics because the top clinics are normally going to be more expensive than us. We're a top clinic. We consider our prices to be very fair for what we do. Actually, sometimes for Strawman cases, you guys are like, dang, that's pretty cheap. But they compare us to the ones that are a lot cheaper, like a lot cheaper. Like down the hall from us, no accreditation's cheaper. Why are you smiling, bro? You know what I'm saying? It's not about walking out, guys. It's not about walking down the hall out of the plaza that we're in and some guy in some scrubs telling you a story on how there's a clinic in the family that's just like ours and they're going to give it to you for cheaper. Guys, if you go buy a Bentley and you go down the street and somebody's trying to sell you a car that's just like the Bentley, it's in the Bentley family, but it's cheaper, it's not a Bentley. Plain and simple. 10 accreditations, 0 accreditations. I don't even know if they know what an accreditation means. They might think it's like a topping in their tacos, bro. Like, it's so different. So I don't get that. And the patient believes that. And then later on they call back and, I'm sorry. Please help me. But you follow the Captain America outside. You know what I'm saying? You just because they're down the hall.
It's because we are like warriors.
You go, ooh.
I feel.
What was that? We're like words.
I can do it. Yeah.
Just because they're down the hall doesn't mean they're good at all. So you just got to make sure that wherever you do your research, you go and you do what's right. Do your research. Be smart. Go with the right people. I'm not saying that we're for everybody, but for the people that come to Mexico, for whatever reason, and they want the best, that's what we're here for. But so what's next, guys? What's next on the Dental Supreme schedule? What do you guys have planned? What do you guys want to reach so far? He's just still in Punta Cana right now.
Yeah, he's not here.
In my case, Sigomatic implant is my next level, and more digital workflow. I think is my next level.
Yeah, I think as a team we're currently working on immediate loads, doing them 100% digital, to be able to do the surgery today and the next day have the teeth ready to set them. And instead of doing so many tests, we could do the test digitally instead of having to do them on the patient. It's just those little things to make everything, because maybe the patient won't. They're not going to see the difference. I don't know if they can, but we know the difference that it makes on the gum, on the final prosthesis, how everything is more exact, more real, more comfortable, because we're actually aligning skulls, not just what we think looks best. I think that's what we're currently working on is making that protocol our own with what we have, the technology that we have, the skill set that we have, and the patients that we have and I think that's what's currently right now on the horizon, and we're working really hard on it. I think David has really stepped up, because sometimes, as you know, we have to push him a little bit, and I think today he was like, you know what, and he decided to do it by himself.
Iron sharpens iron.
Yeah, and I think that's what we're currently working on. We ran a couple of tests last week on real patients, not tests, but where we printed one out, we did a little adjustment, then we got it on the second try. We want to make sure we get it on the first try, and I think that's the little things that we're working on. And then when we have our own little protocol, show it to the rest of the team and make sure that they follow along as well.
Well, that's the attention to detail. So
there you go.
okay,
Yeah.
so you know how to do something, and some places are like, okay, we know how to do it. Wait. Do we know how to do it? Let's take a look. Let's take a look deeper inside. How can we perfect it? Because once we perfect it, when it started with pterygoids, it was like, oh my God, he does pterygoids. This is crazy. Everybody was there, and now you do pterygoids in
Easy.
how fast? A fast case.
10, 15.
5 minutes
5
per
minutes.
per implant. 3.
That's crazy.
Yes, that's
But a lot of
crazy.
practice though.
That's a lot of
We
practice.
placed over 150 pterygoids.
But you
or more, 200.
perfected. You perfected.
Oh,
that.
for sure.
You guys are perfecting that.
Yeah.
So when you perfect something, so now we add it to our arsenal. We don't just say,
I did it
I
two
went.
times.
I went. What is it like? Katy Perry and them. They went supposedly to the moon, and now they're astronauts.
Oh, sure.
It's
Yeah.
like I go to the doctor's office, and now I'm a doctor. It doesn't work that way. You know, there's a lot more intel for everything, and that's what I love is that we perfect something. So we're doing this, but let's perfect it, so we can be even better, even more efficient. So, I mean, hats off to you guys. You guys are always pushing forward. You guys push me and my wife to keep on pushing forward. And the patients, obviously, when they come in, and it's been, you guys, in the beginning, it was kind of weird when a patient would come in. I seen you on a podcast. I seen you on a podcast.
You're famous.
You're famous. Yeah, you're famous. And
Oh, you look bigger now. It's like, oh, shit.
I was talking about your arms, bro.
Oh,
There you go.
we had a patient last week. He came in, and he told us like, "Oh, you got skinnier." He was like, "You got bigger."
Yeah.
Shout out to Brian, good guy.
They told you?
Yeah,
Yeah.
It's a lovely.
They all look at Manny in the screen, and they look at Manny there, and they're like, "Your haircut look better." Man, was it just a haircut? It's love, baby. He's married now. You know,
Yes.
it's love. Come and get your love. But I watch different podcasts now. Before I didn't, and I've been watching that I fully recommend to you guys. It's PBD. They talk about so many different things, politics and all these kinds of stuff. And shout out to PBD, shout out to his crew. I heard something and it reminded me of you guys. Obviously, his phrase is different, but I adapted it to mine. The dental future is looking bright here at Supreme Dental. So the dental future, right now we're doing great. We're doing what other places can't even dream of doing, but it's not good enough. It's good for right now, but we're ready for what's next. And that's what patients say. That's the big difference. You know, we're out there. You guys are not actors. You guys are not podcasters. I was not a podcaster. Now we've been on, I don't know how many podcasts.
How many podcasts?
Like 86.
George was homeless before he started, and now he does camera. Look at it. It's crazy.
He goes to Vegas every
I don't even know.
2 weeks.
He must have a house there. You know? So it's everything has changed. Everything has changed. And obviously that makes me extremely proud because no matter what dentist I'm talking to in the world, and when I talked about you guys, you know, I could talk all day, you know? So you guys are doing great work. The patients think that you guys are doing great work. All of our agents totally respect you guys and you guys respect them. Obviously you guys understand the process. And we were just talking about Kite Saito. That we're saying Kite Saito because because we're saying it in Spanish, but it's Kite Saito. And the gentleman is from Japan originally. He came to California, got a master's degree as a ceramist in UCLA.
UCLA, yeah.
And right now he's in Lafayette, Arkansas, and he is one of the faces of Mio in the United States, which means it's like that liquid ceramic type of deal to make the gums look everything beautiful
stronger man.
on the hybrids. On the hybrids, but made out of zirconia and all that good stuff, the prosthesis. And he's never been to Mexico. He's never been to a training to Mexico.
Never. Wow.
And he's coming to
Supreme Lab.
Is it first
The
time?
Supreme Lab.
In Supreme.
For the first time.
In Mexico? And
Exactly.
Supreme. Wow.
We're flying him over. He's coming down, and he's super excited.
That's a big deal.
Yeah.
That's
big deal, yeah.
in the lab world. That's a huge deal.
Yes.
So he has this little thing he made from Mio, with different mixtures of colors, and in all his videos he uses it because he doesn't just look at your teeth. He actually gets the color from your gum, so it kind of matches your gum too. And I told him, "Hey man, do you sell those?" And he's like, "No, nobody's ever asked me that, but I got 2." And I'm like, "Well, do you want to have only one?" and long story short, we'll put a picture up here. It has he even put his name on it. Kite Saito.
Kite.
Come on, man.
Kite.
And it's and everybody in the lab's super excited. I know Angel is. I know Alondra is. David is not, but that's David. And
And Joseph.
Joseph's doing the titanium bars.
Yeah.
But
The titanium boy.
the TI boy.
Yeah.
But thank you so much for what you guys are doing. It's my job to keep on pushing you guys. It's my job to keep on pushing George. I mean, it's just what I do. And just keep on trucking, guys. Just keep on trucking. So anything else you guys want to say before we leave? Oh, yeah, that's true.
I don't
So
know that.
when-
See?
So before anything, this
Wow.
is true. So
Second anniversary.
thank you so much.
En el mariachi, man.
This is a 2-year anniversary that we have for this podcast, and obviously this has been
2 years?
a blessing. Everything started on hopes and dreams, on what if my wife George and Carlos actually brought it to life, and George just keep on adding stuff, oh, these lights would be nice, you just keep on adding stuff, and everything just it just worked out. So many patients have said, oh, I'm here because of the podcast. I'm here obviously because of the content of the podcast, but they actually listen to these podcasts, and I'm like, oh, that's great to know that somebody watches us sometimes.
That it works?
It works, yeah. So thank you so much, everybody out there. But something before Elias breaks the tables. Anything else before we leave?
Wow, 2 years.
Wow. It's very quick.
You guys are getting old.
Yeah, we're getting old.
Wow.
At first, we were kind of nervous to do the podcast. We're gonna do the. Now it's like
Now we're fresh.
yeah, we want to come down and do the podcast.
Actually, George, can you put a clip? Can you put a clip of Dr. Luis? The first video, a clip of him when he's just like this.
I don't
Sí,
forget
Frank.
my face.
Las carillas, Frank.
And Elias like just goes on the trip, right?
I used to make fun of Luis because he used to do that, and then I noticed that I do the same thing. Like we were talking about that the other day. Like when he's speaking about something, I'm trying to imagine and see what he's and I do this out of and he does it too. Like we're just
It's the same thing. It's training.
I'm looking, is there a TV down there?
zoned out, and then we see George behind the camera. He's like,
Yeah, George is like,
oh shit. Yeah.
And me.
when George is awake, because sometimes he's on his phone and he doesn't.
When the audio's off.
Sometimes you hear La Bota and stuff. So, there you go. He's never gonna live over that one. But you guys, shout out to anybody
Thank you.
before you guys leave. What do you guys want to say? Anything?
Well, trust in us. Trust us.
Trust the process.
Yeah. On
Trust the
on
process, yeah, and
on the process, we are doing the best for you.
we are, and just like us, the lab is also getting training from the best around the world. And I think that it's a quote from Kobe Bryant that he says that, and you mentioned it, how we're perfectioning certain things, which that's the standard. So we're trying to no, the standard is everything to be perfect. So I think that it not only goes, and I think it not only goes with the work that we do, but as the people, not just professionals, as the people that we are, that we want to do the best, because we know the hard work that people have to put in to be able to afford these type of procedures, and we know that, and that's why we want to do the best. And sometimes if we ask for an extra day, it's because we want to make sure that everything works just great.
And sometimes when you're in between, is it going to be a normal implant, or do I have to do a pterygoid implant?
Oh, I learned the hard way.
And we said, hey, well, let's just charge her for the normal implant, you're the one that actually brought that up to me. And at the end, it was a pterygoid implant.
It was a zygomatic.
It was a zygomatic, and it was at the same price. And well, I want to talk to you about that one later on.
Yeah, I learned the hard way.
But it's when we have the patient, when you as a patient are there and you've trusted us already, and you're under sedation, we can't wake you up and tell you, hey, we came here, here's a different game plan, this is what we're gonna do. Like, I know you put your trust on us, you put your trust on these guys, you put your trust on Supreme. We're gonna take care of you.
Yeah.
We're gonna take care of you.
Yes, sir.
So, is that it?
Yep.
Well, thank you so much for being here, Supreme Dental Podcast. Shout out to George also. He's been recording this for 2 years. He's been. I'm sometimes I can be strict. He's just a beautiful, relaxed man.
And
So,
congratulations, Frank.
Thank you
for the podcast.
Thank you so much. Thank you so much. This has been Supreme Dental Podcast Studio, powered by Supreme Dental. And just like these guys, and hopefully you in the future, keep on smiling.
And if you don't know, now you know, you know, you know.
That's right.
And if you don't know, now you know, you know.